Hello, my name is Kira, and my ethnogeriatric presentation is about African Americans. So, based on the survey that we took, some of the things that I found very surprised was the nonverbal cues, such as spending less time touching or looking at the patients, and the microaggression, the unconscious message that we sent that can be considered as insensitive to the individual background. So, how does knowing this approach or change the way I care for this patient? I think the first thing we need to do is to recognize our own biases. Keep yourself informed by staying engaged in a diversity training that includes information or skill based strategy to promote equity, as well as raising awareness for people to see and hear biases when it occurs. Regarding the health risks among African Americans, I think first we need to state that the two terms African Americans or Black tend to use interchangeably. They are the third largest racial group in Minnesota. The individuals and social reaction to illness among Black older adults have been multifaceted over the decades during and since slavery in America. They also have the highest risk for cancer, obesity, diabetes, heart disease, hypertension, and AIDS and HIV. In Minnesota specifically, African Americans have a poor health outcomes for 5 of the 7 Minnesota quality measures, including diabetes care, vascular care, asthma control A, asthma control C, and colorectal cancer screening. And most importantly, I think Black older adults were less likely to say that their homes and community based services meet all of their needs and goals than white older adults. African Americans have usually been found to rate their health less positively, and this slide shows a higher rates of activity limitations among older African American compared to other races. Contributing to the mentioned health risks, the health assessment showed 34% of African Americans lived below the federal poverty level. 19% were unemployed during 2010-2014, the highest rate for any cultural group, and 12.8% lack health insurance in 2017, result in less preventative care and health education. And they make up about 39% of homeless adults in Minnesota, but about 5.8% in the total population in America. 3 important issues for effective geriatric care for African American older adults are knowing background knowledge of the historical events that have influenced their lives and attitude to healthcare, and the second is knowledge of their health beliefs and practices, and third, knowledge of the cause of illness and intervention. African Americans older adults compared to white older adults are more likely to experience poorer access to medical care. When looking at this disparity, 3 important causes that we need to consider are patient-based factors, physician practice patterns, and end-of-life care issues. African American older adults have culturally deprived perception of illness and socially reinforced health behaviors, which significantly influence their help-seeking behaviors, and these perception and behavior contribute to their delayed entry into primary care clinic and hospital. In addition, many healthcare providers have limited knowledge about factors that contribute to ethnic differences in access and utilization of medical services by African American older adults. And lastly, African American compared to white older adults near the end of life tend to receive higher rate of high intensity hospital-based care and are more likely to die in hospital and prefer more of an aggressive life-sustaining treatment. And family members of African Americans were more likely to report lower overall satisfaction with end-of-life care as compared to family of white descendant. For health promotions, African American older adults may rely on various resources to gain medical education and to take care of themselves. This includes traditional healthcare providers, but because of the cultural and religious belief, they may not following the provider recommendation. Therefore, when providing care to this patient population, it is important that we as a provider consider their culture and tradition with the acknowledgement of that social and kinship networks, community, extended family, and the church are all significant players in healthcare and support service system. The last slide of the presentation shows some of the community services that I was able to find around the Twin City metro area to provide community service, healthcare services, mental health help to that targeting the African American populations.